name is Lorelai, and in this video I'm going to be demonstrating how to change a dry sterile dressing. First thing you're going to want to do is assemble your equipment and wash your hands, so I'm going to do that. I did pre-assemble my equipment using my sterile and clinical standards. On my left side you'll see that I have my sterile field, and on my right side here I have a biohazard bag, which is going to be for all of my biohazard materials that I use today. I make sure to keep it on this side, so I do it this way. Things don't cross over the sterile field in order to get into this bag. Things are just going to cross the patient and then go right into here. So the first thing I'm going to do is introduce myself to my patient and verify their identity. So hi, my name is Lorelai. I'm the medical assistant that's working today. I am going to be changing that dry sterile dressing that you have on. Is that okay? Perfect. Can I get your last name and date of birth? Wonderful. Okay, so once I have that consent, I'm going to go ahead and loosen the tape on the arm. You don't want to take it off completely because you do want to keep the things under the bandage sterile. Alright, once it's loosened, I'm going to go ahead and put on these non-sterile gloves. Alright, now I'm going to go ahead and remove the bandage. It's not sticking, but if it was to be stuck to the patient, I would pour some sterile water on top of the bandage, and that would just kind of soak in there, let it sit for a few minutes to loosen everything up, and then I would pull the bandage off instead of trying to rip it, because I don't want to mess up that healing process. So I'm going to go ahead and put this bandage into the biohazards bag, and then I'm going to assess the wound for any infection or any drainage, which it looks like his wound is healing well. So I'm going to go ahead and remove these gloves and wash my hands again. Once my hands are clean, I'm going to want to don some sterile gloves. So I've got some sterile gloves here. I'm going to go ahead and check this packaging, make sure that it's not expired, making sure there's no holes or rips. This one I've used before, but we're going to pretend there's not. So as long as the package looks good, I'm going to go ahead and open these on a nice clean area. Carefully taking the pack out. I'm going to go ahead and set these down. Unfolding super carefully. Alright, I'm going to fold down the edges, being careful not to touch the gloves. Go ahead and scoop in like this and pull it on out. Again, being careful not to touch the gloves. I'm going to start with my non-dominant hand. Scoop my fingers in there. And then I'm going to only touch the outside of the cuff, inside of the cuff, I apologize. Alright, now that that hand is on, I'm going to go ahead and slide into the outside of the cuff now. And then slide my other hand in. Okay, now I'm going to adjust both the cuffs, only touching the outside of my gloves with my gloves to keep things sterile. Alright, now I've got sterile gloves on. Now that I've got on my sterile gloves, I'm going to go ahead and take my sterile swab stick. I'm going to open it up. I only need one of them, so I'm going to take one out. And I'm just going to go ahead and clean that wound. Real good. You're going to use circular motions, starting inside and going out. That sterile swab stick's going to go right into the biohazard bag. Once that's all clean, I'm going to go ahead and take these two little swab sticks and pick up a gauze pad. It's always easier said than done. Okay. I'm going to set that right onto the wound, and I'm going to use these sticks to just kind of secure it down. Alright, now these sticks go right into that biohazard bag there. I'm going to go ahead and remove my gloves. Put those in the bag. Typically this bag's bigger, but I ran out of bags. I'm going to go ahead and wash my hands. Alright. Gonna go ahead and just wipe off any excess iodine just because the tape won't stick without it being wiped off. Now I'm going to use tape to secure the bandage. Perfect. Now I'm going to go ahead and take the biohazard bag and seal it with a tie and throw it in our biohazard bin. And then I'm going to go ahead and document my procedure in the patient's medical file.